So a patient came to you with shortness of breath, and you examined his lungs, but they were clear. There were no added sounds, there were no wheezes, there were no crackles. So a patient may come with shortness of breath with respiratory symptoms, and it's easy to diagnose them. If they have crackles, you may diagnose a pneumonia. If they have reduced breath sounds, you may diagnose a pleural effusion or a pneumothorax. But it gets tricky when they come with shortness of breath and there are no respiratory findings. So there are a few non-respiratory causes of shortness of breath, and most of them relates to the chemoreceptors that we talked about in the episode 2 of Physiology 101 series. So go watch it out. So causes like severe anemia, which may stimulate the chemoreceptors due to the hypoxia and may cause shortness of breath. Causes like metabolic acidosis also stimulate chemoreceptors and cause shortness of breath, but the chest will be clear in most of the cases. In myocardial infarction, patient may present with shortness of breath, and sometimes the chest is clear, unless they are in frank pulmonary edema. Or patients with pulmonary embolism may present with shortness of breath, and the chest may be clear, and the shortness of breath is due to increased right heart strain. Severe anemia, metabolic acidosis, pulmonary embolism, myocardial infarction, and honorary mention, anxiety.